Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan selamat pagi. Terima kasih kepada semua hadirin, peserta dan juga tokoh-tokoh yang telah bersama pada hari ini dalam webinar umum Bicara Emas Alumni Fakulti Perubatan UKM sempena sambutan Jubli Emas UKM. Jadi tanpa membuang masa lagi, saya menjemput Yang Berbahagia Profesor Datuk Insinyur Dr. Muhammad Hamdi Abdul Syukur, Naib Chancellor UKM untuk menyampaikan ucapan aluan. Silakan Datuk.
Terima kasih Saudara Pengurusi. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Saya harap saya boleh mendengar suara saya. Boleh. Pertamanya saya syukur kepada Allah SWT kerana hari ini kita dapat bersama-sama lagi di dalam acara Bicara Emas kita, dan pada kali ini adalah Alumni Fakulti Perubatan UKM. Kita berbangga kerana kita ada pada hari ini dua orang tokoh tersohor alumni UKM, iaitu yang tidak asing lagi Datuk Dr. Noor Hisham Abdullah, Ketua Pengarah Kesihatan KKM, dan juga Tan Sri Jemilah Mahmood, Nasihat Khas kepada Yang Amat Berhormat Perdana Menteri mengenai kesihatan awam. Saudara-saudari, saya ingin mengambil kesempatan ini untuk memperkenalkan kedua-dua tokoh yang akan berbicara kepada kita pada hari ini, yang mana saya percaya perbincangan ini akan dapat dimanfaatkan oleh kita semua. Izinkan saya memperkenalkan dahulu Datuk Dr. Noor Hisham Abdullah, tokoh yang sudah tentu tidak asing lagi kepada kita semua, yang merupakan tokoh yang kita harapkan di dalam berhadapan dengan COVID ini. Dan saya ingin memperkenalkan beliau, merupakan lulusan UKM, seorang pakar bedah terlatih, dan kerjaya beliau dalam bidang perkhidmatan perawatan pesakit ini telah meletakkan beliau pada hari ini sebagai Ketua Pengarah Kesihatan atau yang kita biasa panggil DG. Anak kelahiran Sepang, Selangor, kelulusan dalam ijazah sarjana dalam bidang surgery dan juga ijazah doktor perubatan, yang mana kedua-duanya adalah daripada Fakulti Perubatan UKM. Mula menyertai perkhidmatan awam sebagai medical officer pada Ogos 1988. Beliau juga sekarang ini pernah menjadi pengerusi Jawatankuasa Pembedahan Global Persatuan Pembedahan Antarabangsa. Semasa di KKM, antara jawatan yang pernah di sana ialah Ketua Jabatan Pembedahan Payudara Endokrin dan Pembedahan Am di Hospital Putrajaya. Beliau juga menjadi pakar perunding bedah kanan Hospital Putrajaya pada 2007. Kerjayanya juga bermula sebagai pegawai perubatan pakar bedah umum di Hospital Putrajaya, dan sebelumnya lagi ialah pakar bedah umum, iaitu pada tahun 1994. Hadirin hadirat sekalian, seorang lagi tokoh yang ternama yang telah dilahirkan oleh UKM tidak asing lagi ialah Tan Sri Dr. Jemilah Mahmood, yang sekarang ini menjadi penasihat khas kepada Perdana Menteri. Beliau merupakan sarjana dalam bidang obstetrik dan gynecology dan ijazah doktor perubatan daripada UKM. Merupakan fellow di Royal College of Obstetrician and Gynecologists UK. Selain itu, beliau juga pernah menamatkan pendidikan eksekutif di Pusat Pengurusan dan Pembangunan Antarabangsa IMD di Lausanne. Merupakan pengasas Mercy. Saya ingat semua kita, rakyat Malaysia ni kenal Mercy ni. Sangat popular khususnya dalam kerja-kerja NGO membantu masyarakat dalam dan luar negeri. Beliau mengetuai Mercy pada 1999 hingga 2009, 10 tahun Tan Sri di situ dan telah banyak memegang jawatan di peringkat nasional dan antarabangsa dalam NGO dan juga international NGO. Beliau menerima anugerah Merdeka pada tahun 2015 dan antara yang telah menerima, barangkali rakyat Malaysia yang pertama menerima anugerah ISA, iaitu Award for Services to Humanity daripada Kerajaan Bahrain. Pada 2016, Tan Sri telah menerajui Persekutuan Palang Merah dan Bulan Sabit Merah Antarabangsa IFRC. Dan sebelum menyertai IFRC, Tan Sri adalah Ketua Sekretariat Kemanusiaan Dunia di PBB yang beribu pejabat di New York, Amerika Syarikat. Kita juga berbangga kerana Tan Sri adalah merupakan rakyat Malaysia yang pertama menerima hadiah ASEAN pada tahun 2019 dan beliau juga telah diamanahkan sebagai Gubernur Masyarakat Sivil Yayasan Commonwealth dan juga merupakan ahli Lembaga Institut Keuangan Bertanggungjawab Global. Dan pada tahun 2019, Tan Sri Jemilah telah dilantik sebagai ahli Lembaga Pengarah UKM. Seperti Datuk Dr. Noor Hisham juga, Tan Sri adalah merupakan antara yang berhadapan di dalam melaksanakan tindak balas kepada Covid-19 ini dan beliau merupakan anggota di dalam Majlis Tindakan Ekonomi Kerajaan Malaysia. Jadi kita bertuah pada hari ini tuan-tuan dan puan-puan dapat berhimpun secara maya ini untuk mendengar pandangan, ulasan dan juga nasihat daripada dua-dua tokoh yang sangat kita hormati ini. Semoga sesi ini dapat dimanfaatkan sepenuhnya oleh kita semua. Bukan mudah untuk mendengar direct daripada Datuk Noor Hisham dan juga Tan Sri Jemilah. Oleh itu saya harap tuan-tuan dan puan-puan dapat menumpukan sepenuh perhatian dan juga dapat mengambil apa jua mutiara kata yang akan disampaikan oleh kedua-dua tokoh yang kita hormati ini. Jadi bagi pihak UKM, kita sekali lagi ingin mengucapkan terima kasih yang tak terhingga kepada kedua-dua tokoh alumni tersohor ini, Datuk Noor Hisham dan juga Tan Sri Jemilah kerana sudi bersama-sama dengan kita pada hari ini di dalam Bicara Emas yang akan kita jalankan sebentar lagi. Jadi sekian dulu. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih Profesor atas kata aluan sebentar tadi. Dan tanpa membuang masa, saya menjemput moderator kita pada hari ini, Profesor Dr. Roslina Abdul Manap. Beliau merupakan Timbalan Dekan Prasiswazah Fakulti Perubatan UKM dan adalah seorang pakar perunding kanan perubatan respiratori di Hospital Chancellor Tuanku Mukris. Saya jemput Prof. Roslina, silakan.
Assalamualaikum dan salam sejahtera. Alhamdulillah, pagi ini kita sangat bertuah kerana penceramah jemputan khas kami iaitu Yang Bahagia Datuk Dr. Noor Hisham Abdullah, Ketua Pengarah Kesihatan Kementerian Kesihatan Malaysia dan Yang Berbahagia Tan Sri Dr. Jemilah Mahmood, Penasihat Khas kepada Yang Amat Berhormat Perdana Menteri mengenai kesihatan awam kerana dapat meluangkan masa bersama kita untuk program web seminar umum Bicara Emas Alumni Fakulti Perubatan UKM sempena sambutan Jubli Emas UKM. Para hadirin, acara webinar Bicara Emas ini merupakan inisiatif siri webinar yang dianjurkan oleh Fakulti Perubatan UKM sempena sambutan ulang tahun ke-50 penubuhan UKM. Untuk makluman para hadirin semua, tahun ini Fakulti Perubatan UKM juga menyambut ulang tahun yang ke-48. Sebagai warga UKM, kita semua bangga dengan pelbagai pencapaian UKM, namun semestinya mesti ada ruang untuk penambahbaikan, terutamanya dalam usaha kami untuk mencapai status universiti tersohor di prasada dunia. Yang Berbahagia Datuk dan Tan Sri, sekali lagi terima kasih kerana sudi menerima jemputan kami. Saya pasti akan ada banyak soalan dan perkongsian ilmu serta pengalaman pada pagi ini. Dan mungkin Yang Berbahagia Datuk dan Yang Berbahagia Tan Sri boleh beri sedikit kata-kata aluan sebagai permulaan. Boleh unmute mic ya? Terima kasih.
Assalamualaikum warahmatullahi wabarakatuh. Kita tengah debate siapa jalan dulu, tapi Hisham gentleman dia bagi saya dulu. Terima kasih Prof. Roslina. Assalamualaikum semua. Saya rasa amat berbangga kerana dapat menghadiri webinar ini. Memang bila kita sendiri joke DG dan saya tentang UKM taking on all the crisis jadi saya rasa ini satu peluang yang baik untuk juga memberi inspirasi lah kepada pelajar-pelajar UKM bahawa kita boleh bertanding bukan hanya di dalam negara, but juga di luar negara. Dan Covid-19 merupakan satu krisis yang telah menimbulkan banyak sebenarnya isu di mana multi-sectoral approach diperlukan, bukan saja di perubatan tapi dari segi ekonomi, dari segi alam sekitar dan sebagainya. Dan saya juga rasa bangga kerana EAC sendiri, Economic Action Council, di sekretariatnya diketuai oleh mantan Vice Chancellor UKM. Jadi macam UKM family lah yang bekerja di dalam menangani COVID-19. Jadi kita setuju dengan cara conversational dan DG dan saya pun kawan dah lama dan kita amat berharap webinar ini akan bermanfaat kepada semualah yang mendengar. Terima kasih.
Terima kasih. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera dan selamat pagi kepada semua. Yang terdahulu saya ingin ucapkan terima kasih kepada UKM untuk mengadakan webinar ni. Dan tadi saya dahulukan senior kita dan wanita dulu untuk bercakap. Dan yang tu adalah kalau kita lihat sekarang ni dalam respon kita. Jadi kita ramai di kalangan graduan UKM telah mengambil kepimpinan dalam menjalankan tugas di Kementerian Kesihatan. Dan ini adalah satu jaringan yang baik yang dapat kita bekerjasama antara satu sama lain. Tetapi apa yang penting ialah untuk setiap graduan, kita harap dengan adanya webinar ni kita dapat memberi inspirasi kepada graduan kita. Jadi ada harapan baru dan apa yang perlu kita laksanakan ialah kesiapsiagaan kita lah sebaik mungkin. Dan apabila kita menjalankan tugas yang penting, apa-apa tugas yang telah diamanahkan kepada kita, kita laksanakan secara ikhlas dan niat kita tu penting. Segala tugas ataupun amanah yang diberikan, niat kita penting iaitu ikhlas, jadi fi sabilillah, dan juga kita buat kerja tu bersungguh-sungguh. Lepas tu baru kita tawakal kepada Allah SWT.
Ya. Terima kasih atas kata-kata luan dan kata-kata yang memberangsang kepada terutama sekali pada para pelajar Fakulti Perubatan UKM dan UKM secara amnya. Jadi sebagaimana yang dimaklumkan, sesi ini akan dijalankan secara interaktif dan saya mohon agar para hadirin untuk menaip soalan-soalan sama ada dalam bahasa Melayu ataupun bahasa Inggeris di ruang question and answer Q&A dan bukan di ruang chat pada skrin. Baik, kita bersedia Tan Sri dan Datuk. So kita mulakan. Saya difahamkan Datuk ada sedikit yang nak disampaikan terlebih dahulu. Jadi melalui slide dan sedikit pembentangan. Jadi saya persilakan untuk share skrin.
Okey, tindakan kita selama tempoh lebih kurang 7 bulan, kalau kita lihat, kita mula pada bulan 12 2019. Jadi apabila ada wabak di negara China iaitu di Wuhan, jadi kita dah mulakan siapsiagaan kita di Kementerian Kesihatan sebab kita dah jangka wabak ni akan datang, akan menular ke Malaysia tak lama lagi. Jadi dengan itu kita ada tempoh masa yang telah diberikan untuk kita siapsiagaan, menjalankan siapsiagaan kita. Jadi yang pertama ialah kita hidupkan kembali iaitu CPRC, iaitu Crisis Response and Crisis Preparedness and Response Center, bukan hanya di peringkat kebangsaan tetapi di negeri-negeri, dan juga kita melaksanakan melihat kepada protokol, sistem, logistik dan sebagainya. Yang itu yang penting. Lepas tu kita lihat dari segi beberapa tindakan kita. Yang pertama, untuk kita memerangi COVID-19, kita perlu mengesan virus tersebut. Jadi kita kena pemekasakan makmal, iaitu IMR telah menjalankan ujian dan sebagainya menggunakan kaedah-kaedah RT-PCR. Tapi kita tak ada genomic sequence. Bila 3 hari bulan Januari 2020, apabila negara China memaklumkan genomic sequence dan kita menggunakan genomic sequence terus kita dapat primer untuk mengesan virus tersebut. Dan walaupun ketika itu WHO tak keluarkan lagi protokol untuk pengesanan virus. Dan apabila kita dah ada protokol tersebut, kita melaksanakan latihan untuk pengesanan virus tersebut untuk awam dan juga di swasta. Dan kita mula dengan 23 makmal dan kita dapat laksanakan 1000 ujian. Ketika itu tak ada pesakit lagi pun di Malaysia. Dan kes yang pertama yang kita terima ialah 24 Januari, iaitu kes indeks di Singapura, tetapi kumpulan tersebut dan keluarga yang berkaitan dengan kes indeks itu telah pun datang ke Johor Bahru. Dan kita melaksanakan sebagaimana kita dilatih, iaitu dalam tempoh 2 bulan kita melihat kepada tindakan kesihatan awam, iaitu bagaimana kita laksanakan acute case detection, contact tracing dan sebagainya. Dan protokol yang kita ada masukkan ke sistem tu disalurkan di kementerian. Jadi ya, proses-proses di sebalik takbir ini yang penting, yang untuk kita lihat bagaimana kita dapat kumpul maklumat, menggunakan logistik, mengerahkan staf-staf kita daripada negeri-negeri lain ke negeri Selangor dan Kuala Lumpur dan sebagainya. Dan juga kita lihat pada hospital kita pun dah sesak sebelum lagi Covid-19, tetapi dengan perancangan kita dalam tempoh 2 bulan, kita dapat decan hospital di Kementerian Kesihatan di Sungai Buloh, 7 hospital decan untuk pesakit COVID saja. Pesakit bukan COVID telah kita pindahkan ke hospital cluster, iaitu hospital daerah dan sebagainya. Jadi yang inilah tindakan kita dalam kita melaksanakan pemindahan. Kita perolehan untuk mendapatkan lebih banyak ventilator, peralatan dan sebagainya, kesiapsiagaan kita dalam segi gunakan ICU, katil rawatan, ward rawatan adalah kekurangan, tetapi kita telah dapat meningkatkan jumlah katil-katil ICU di hospital dan sebagainya, sebab kita telah jangkakan mungkin kes akan menambah. Kalau kes menambah, kalau masuk ke hospital, dan hospital akan mungkin akan jadi sesak dengan pesakit yang tenat dan kita tak cukup ICU. Tapi kita juga membina hospital sementara dalam tempoh 4 hari, iaitu di Maiz, iaitu hospital yang dapat menampung 600 katil, tetapi dapat diperkembangkan hingga 1000 katil. Dan juga kita mengambil tindakan-tindakan yang lain untuk kita siapsiagaan kita. Yang tu yang pertama, kesiapsiagaan. Kedua, yang kita rasa dengan pengalaman kita yang lepas, jadi kita belajar daripada pengalaman kita mengendalikan SARS, MERS-CoV, H1N1. Jadi pengalaman tersebut telah membantu untuk kita menambah baik kesiapsiagaan kita lah. Yang ketiga, kalau kita lihat juga ialah organisasi kita dah sedia ada, dan bagaimana kita boleh mantapkan organisasi kita untuk kita jangka apa yang akan datang. Dan yang paling penting ialah kepimpinan. Kepimpinan kita hari ini di Kementerian Kesihatan ialah kepimpinan secara kolektif. Dan juga kita amalkan, kalau kita baca buku ialah servant leadership, iaitu yang pertama kita berkhidmat dulu. Jadi perkhidmatan tu yang penting. Jadi dalam servant leadership ni kita serve dulu. Dan kalau kita lihat sekarang ni, kita menggabungkan perkhidmatan kita collectively dalam Kementerian Kesihatan dan menggunakan rangka framework, iaitu menggunakan whole government dan whole society approach. Inilah resipi kejayaan kita, iaitu 5 faktor ni lah, iaitu yang pertama pengalaman kita, kesiapsiagaan kita, organisasi sistem kita, health system kita dan juga kepimpinan kita. Terima kasih.
Webinar ni akan dikendalikan dalam 2 bahasa. So if I may just summarize that, the preparedness, the organization, leadership and capacity building were among some of the most important things that helps Malaysia as a country to overcome and to fight this COVID pandemic. May I hear from Tan Sri Jemilah about her views on how Malaysia succeeded in containing this pandemic, maybe also the role of the CSOs in this, and her views on the leadership that was displayed during this time.
Yeah. Do you want me to speak in English or in Malay?
Doesn't matter. We have some international audience as well, so
Oh.
So let me speak in English
English,
because it's much more easier. I think just to build on what was said by DG, I think that leadership is very key. Leadership is about making the right decisions, particularly in a crisis like a pandemic. One of the biggest challenges we face, not just in Malaysia, but I'll give you also the global perspective, is that the impact on the economy is something that is really quite profound. Malaysia itself is, during the MCO period, the loss of revenue was 2.4 billion a day ringgit. So you can imagine that making these difficult decisions will require a bit of a balancing act, taking the evidence and then making those very difficult decisions. At the end of the day, to be honest, whatever decision is made, there will be people who are unhappy. So I think what DG probably didn't elaborate further was, I was in Geneva when this happened, so we were in touch with WhatsApp and sharing what we were hearing at WHO, as well as what my own organization was doing, and sharing key messages, because I came from a very large organization that is present in 192 countries. And what are the key messages we're delivering that could be helpful for Malaysia. So we were doing a lot of this back and forth, but I kept saying to DG, at which point will we close our borders? At which point will we actually start very seriously looking at movement control? And I think he brought this evidence to leadership that had to make that very difficult decision. It's never too early, and it's sometimes too late. But these considerations on economy are always very difficult one, also foreign relations, trade, and so on and so forth. So leadership is very key. Making a decision is very, very important. The second, of course, is that, where we have done well is Asia generally has experienced several epidemics, like, SARS. Malaysia has experienced Nipah virus. We've had H1N1, we had MERS-CoV. And if anyone says that COVID-19 is a surprise, then they're obviously not thinking, because all the signs were there for a pandemic. It was a matter of when and not a matter of if. So what KKM has been able to do under DG's leadership is really to create that playbook where, when there are signs and symptoms that this is going to go the wrong way towards a pandemic or epidemic or whatever, those whatever DG mentioned earlier will be put in place very, very quickly. So I returned, just before lockdown. No, actually, I returned during lockdown, but I was on home quarantine. So working together with, the Prime Minister's Office, DG, and others at EAC as well, where I belong, where I think we saw the need was to bring the health economic approaches to be very much synchronized. Economists cannot make decisions based on the economy alone, where health perspectives must be brought in, and that was part of my role. But health practitioners cannot also make decisions on health alone, because there are also other considerations for the rakyat. If they have no money, no income, and there are other diseases, NCDs and all that need to be paid attention to. So how do we then bring that fine balance? And I think this is where we work really, really well. We're very lucky to have a partnership that could drive this. When I talk about whole of society approach, of course, coming from a humanitarian civil society background, the role of civil society and private sector is very key. And very early on in my tenure, I made it very clear to the Prime Minister that we need to have some mechanism where the private sector, the civil society organizations can participate in a healthy way, that we can then ensure we don't leave many behind. Because there is a tendency, when you look at it from a Putrajaya perspective or a state perspective, you see things that you see, but there are many things on the ground that are unseen. Homeless people, refugees, migrants, women-headed household, people with disabilities, often unseen. So this is where civil society comes in very, very importantly, because they are on the ground, they have a grassroots approach to things, and they can actually be witness and give that information back to government. I think that's very important. And so we've established now a Malaysian Action Coordination Hub, which is set up by a group of people who wanted the same thing. You can learn more about it if you look at the Google. But at least we're able to capture data, and private sector was so willing to contribute to the response, but there was no coordination mechanism. So thankfully, Yayasan Hasanah gathered GLCs, the government-led corporations, and then coordinated what the needs were, and actually supported KKM, in procurement of ventilators and other medical needs. So I think that private-public partnership, the private meaning not just private sector, but also civil society and the public at large, is so important for us to manage the pandemic. As we go forward, we're witnessing now, and I'm sure DG will talk about it, that the Ministry of Health alone cannot deal with the pandemic, because they can do things like surveillance, treatment, and so forth. But behavioral change must come from the people, because if you don't have behavioral change, you will get a resurgence of COVID-19 infections. So I think this is what we're witnessing today, in the sense that the public is becoming more lax, and I think this is where civil society, the private sector, plays a critical role in actually reinforcing what the Ministry of Health is doing, and also playing a role to ensure that we don't, have another spike of cases as a result of society now taking a very easy view on, there's been an informal survey done by my former organization, and once the full results are out, I can share that. But in Asia alone, Malaysia has the lowest number of people who think COVID-19 is dangerous. Basically, our people think it's not dangerous. And more than 75% of people outside KL don't really care about it. So this is really worrying.
Thank you, Tan Sri. So what I'm hearing here is that the importance of public-private partnership and the engagement of all layers of societies, which with the help of NGOs, and that there needs to be coordinated action in order to bring the private sector especially to contribute, and there needs to be coordination in building capacity in terms of the donations and so on. So on this matter, Dr. DG, along the terms of this coordination, what were the challenges? Because everyone was quite emotional at the early part of this major crisis, and different parties had expressed their own thoughts and criticisms. And how did you handle this situation with so many parties having to bring people together?
First is that you need to make a right decision, just what Tan Sri mentioned just earlier, right decision. But the issue is, what is the right decision? Because this is this is a pandemic, and we have no experience, it's unprecedented before. But the most important is to make a right decision, and it's a balanced decision, right? So how to strike that balance? So we are looking into the life and livelihood, and then we'll have to look into the overall in terms of how to approach this issue. So in the beginning, we were in the acceleration phase, and a lot of research and published research have actually anticipated that we will have the peak in April. So we are moving towards a very dangerous phase, and we need to look into what's happening in our environment. And we know that we have a first wave initially on the 24th of January, we have our first case, until 11th of February, that is case 22nd. So that is the first wave, all related to tourists coming from China, from Wuhan, directly or indirectly. A few Malaysians been infected as well, but they have exposure to the tourists from China. And then we have about 11 days, there's no cases at all. We call it the calm before the storm. Then comes case 23rd, 24th, and 25th, and so forth. And these are the cases that Malaysian coming back from overseas, Malaysian returnees bringing the infection. So our problem at that point of time, our issues is the virus will be brought back by Malaysian from China, from Japan, from Korea, from Iran, and even Italy. So these are 5 countries that we have identified. initially in the phase 1 of first wave, we do not feel the social disruption, the economic disruption, but we managed to contain the virus within a short period of time, and we are able to treat all the 22 patients well. No fatality, and all the 22 patients were discharged. But come second wave, when we got to know from the Ministry of Education at that point of time, and I believe many Malaysians already bought tickets to go for cherry blossom in Japan and Korea, and we were told that 8,000 teachers already been given the approval to go to tour in these 5 countries. Therefore, our concern is if they go for the tour with the family, and then at least we are looking about 30,000 Malaysian returnees bringing back the infection. That's one. Second is that we also been informed by our counterpart in Brunei on the 9th of March that one of the citizens attended perhimpunan Jemaah Tabligh in Sri Petaling and was tested positive. And on the 10th, we went down to the ground, and most of the participants already left the mosque, and we were told that 16,000 Jemaah Tabligh gathered in Sri Petaling Mosque, of which 1,500 from overseas and 14,500 locally. So, and they have gone back to their own hometown, and which means that within 2 weeks you will see a spike of cases. Then, sure enough, on the 10th and 11th of March, we have 2 patients from Pahang and as well as in Negeri Sembilan detected positive. So we anticipated that within 2 weeks this will spread like a wildfire, and sure it did. So Tabligh group actually, when we went back, they have a KPI to actually attract 40 people a day to come to the mosque, and that's where the spread of this virus infection until 5 generations. So, and it continued to have 17 cluster and subcluster. So these are the challenges that we have. Number 1 is the Malaysian returnee. Number 2 is the Tabligh group has actually spread the infection in Malaysia, including in Sabah and Sarawak, whereby they have started in terms of a border control much earlier. So with that information, then we have to inform the new government then to take a drastic measures. That is actually to have the border control and the MCO. And it's not easy for the Prime Minister to make that decision, but we have to make that decision. And he did make that decision. More importantly, we created this artificial environment whereby everyone is encouraged to stay at home, and then we can do our public health activities intervention. And we continue to enhance our public health intervention, case detection, contact tracing, and identify the cluster. And if there's an outbreak in certain area, we initiated the enhanced MCO order, and basically to test everyone. And our policies are very clear that all positive patients will be admitted to the hospital, regardless whether they have symptoms or not. So and then we isolate them in the hospital, and then Malaysian returnees must be quarantined. That is a must. These are the 2 things that helps us to contain the infection locally. So we have seen it costs us a lot in terms of 6 weeks. The most important difficulty and challenges that we have is to manage the public expectation, as what you mentioned. And how do we do that? So we need to have daily PC. This has been decided by the Prime Minister's office, and I will address all the health issues every day without fail, giving information. And this is important when we engage. Once we engage, we explain all the issues and challenges, and we build expectation. So, and then we try to calm the public down, and the public have the expectation, and whatever we say, we deliver. So the public can see whatever why we do it, how we do it, and all the reason behind it. So we can actually make the public understand the situation better, then the fear will be less. This is important for us to move on. And managing the expectation of the public is certainly a big challenge. But if you can deliver beyond that expectation, then rest assured you can actually build public trust. So that's what we did over the last couple of months, and be able to build the public trust, and we share information. And we have been challenged and we have been questioned a lot of issues, but we explain based on facts, based on science, not based on fear, not based on rumors. And what's more important is for all of us, the public sector and private sector, to be united. And once we are united, there's endless possibility that we can do, and we can make the impossible possible. So this is some of our engagement, and until today, we still have the engagement, but it's less. Before that was every day we have an engagement. 5 o'clock, that's my role, and 2 p.m. will be our Datuk Sri Ismail Sabri addressing non-medical issues and challenges, and the implementation of the plan for the whole country. So it's a very coordinated implementation. That means we are looking into all sector is a health sector, all ministry is a health ministry, and this is why we succeeded, because the leadership listens to the civil servant, the leadership trusts the civil servant, and because we work as a team, and there's actually a meeting every day without fail, and all the issues that we have, we argue, we fight, and then we come up with consensus. And why? Based on facts and data. Sometimes there's a proposal that, but maybe there's actually a contradicting view, but we argue and then we look into facts and then we make the decision. Once we make the decision, the whole government supported the decision and we implement it. And more importantly, we can do implementation fast, make fast decision and first to implement it within a short period of time. So in the Ministry of Health, the structure is already in place because the DG is in charge of every sector in the Ministry of Health, every division in the Ministry of Health. So we can have the coordination there. And doing the inter-ministry meeting with Datuk Sri Mehan, and occasionally 3 times a week chaired by the Prime Minister as well. So the Prime Minister is leading the whole government approach. And we are giving the advice to the Prime Minister, and the Prime Minister listens. Sometimes there's questions, then we have to clear the air and based on facts and evidence again. And the Prime Minister listens and trusts the civil servant, and that is the recipe of success that we have today.
Thank you, Dr. DG. So what is important here is the trust between the leaders and the civil servants, the technocrats, clear communication and an all-of-government response, and clear communication to the public, which leads to a coordinated all-of-society response. And the discussions, of course, are based on evidence, and decisions are made based on evidence. Regarding these decisions, was it difficult to collaborate between the private and public sectors during the pandemic? For example, cost sharing, testing, hospitalization, and on therapies. And was there any particular challenge in coordinating the healthcare between public and private institutions?
Well, when we look into this crisis, I think globally, I think the public's aware. But all of us have one goal, I think, that is actually to end and to mitigate this virus infection. So we started engaging with the public very early, even in January, before we have our first case. We already have engaged with the public, the ambassadors, our private sectors, coming together, see how best we can work with each other. So I think the coordination started much earlier than that, and but certainly we can enhance it further. Looking back now, what should we do? Perhaps we should have a system in place whereby we can trigger the system straight away. We can communicate rather than have to write to them face to face. So daily communication is important, and then to update the information to the civil society as well as in the private sector. And when we coordinate, everybody have a role to play, say from top down to bottom up. And this is where I think we can improve. Looking into the next pandemic, probably we can improve in terms of investment in the system, coordinating the public and the private, and then trigger the certain groups so that there's no duplication in our services that we provide. And how can we coordinate in terms of the manpower? For example, here 2,500 posts available, and some of the specialists and even nurses in the private sector crossed over to work in the public sector. So within a short period of time. So how do we mobilize people, not only inter-ministry, but also from the private sector coming to the public sector? So the coordination with the university, how can we have a platform that we can update daily the information and coordination? So all these point out to a whole government and whole society approach.
If I can build on that, Prof. I completely agree. I remember that, you know, what we realized, I think in hindsight, it's always 2020. But I think that, you know, as we look forward to, you know, my role is actually to support the Prime Minister and the Ministry of Health to look at health reform in the country. I think what DG has alluded to is really for a systems approach. At the moment, with this crisis, a lot of it was also quite ad hoc. It was because we knew people could reach out to us. You know, DG is so approachable. He was that public figure, the public face that built trust between government and the community. But moving forward, I think how could we better optimize, right, the utilization of private sector? You know, there were a lot of private hospitals, clinics that were actually suffering because of COVID, because they didn't have, you know, enough patients and so forth. Whereas our government hospitals were burdened, were really overloaded. The nursing staff particularly were really, really stressed. I think we don't talk enough about nurses and paramedics. It's not just doctors. The worst was actually the nursing fraternity that was burdened. And I think that we need to evolve into systems where it's quite a seamless process between private and public sector, and private including university hospitals as well. How do we ensure that overflow of patients can be directed to private hospitals? How do we make sure that even university hospitals that were receiving cases would also be well equipped, that would also have, and most important, I think, moving forward is that we need to have a really comprehensive learning exercise and really look at what next, right, in the management of pandemic, because this is not going to be the last. We know that it will recur, and I think it has revealed some areas where we really need to relook at systems change. I think that is quite obvious. DG and I are working on a book together, which we plan UKM to publish, and because we really want to, take the lessons here and really reflect from a very people's perspective. Sometimes we forget that in the management of pandemic, we see the Director General, you might see me occasionally, you will see the health professionals, but there's everyday people who are doing amazing things during this pandemic. And I think we have a lot to reveal and tell the story of how a nation came together, right? And what lessons did we learn? What is going to be there for the future. So I'm plugging this in now because we're doing this because we want it to be for the alumni fund. We're not, we are really hoping that we can contribute beyond what we're doing now to UKM. And it's just so unique that 2 UKM graduates are staying in this position right now.
Yes, thank you, Tan Sri. I couldn't agree more. And I'm sure UKM will be very happy to publish this book. And we need to learn the lessons, but just taking up on the cue of how Malaysians came together, there's certainly many unsung heroes. The ordinary man on the street who played roles that we never foresaw before this, and how people that perhaps were deemed inconsequential before really came to the fore, and played their role for the country. And I think that's one thing that we saw in this pandemic. So we look forward to this book. It's certainly, the lessons that we can learn. So in both of your opinions, how could Malaysia do better in the future? How prepared are we for the next pandemic, having gone through this? It's not over yet, granted, but how prepared would we be to face another major health crisis along these lines?
how long is a piece of string, right? I mean, it is, no matter how prepared you are, you will always need to do more. But one thing for sure is that, we can't let this go to waste, and that, there has to be greater investment in pandemic preparedness, or generally crisis, health crisis writ large. I keep saying this, there's no security without health security. Without health security, you have no economic security, you have no social security, you have no personal security. But health, the pandemic didn't arise on its own. It's a consequence of, environmental degradation, man's, insatiable hunger and quest to do things which are probably quite unreasonable in our contact with, animals and so forth. A lot of the pandemics we're seeing now is majority as a result of zoonosis. So we need to really, re-examine from a systems perspective of where we have really, done a lot of damage to ourselves. I'm a big fan of planetary health, right? This is a discipline that's coming up. My dream is to set up a Asia Pacific Planetary Health Center, because I think we've got to also, as medical professionals, start to look into our interaction with the non-medical field, because everything is going to boil down to a health crisis if we don't watch out, whether it's climate change, the emergence of diseases and so forth. So I think there's a lot that we have to look at. There's a lot of systematic investment in preparedness. It's easy to say, well, let's be prepared. It does cost money. If you want to set up systems like Vijay was saying, how do you, improve your digital dashboard where people can get information and so forth? How do you coordinate better with others? How do you make sure that community-based health is something that is paid attention to, which is primarily done, by civil society. In that case, how do you strengthen civil society to be able to play that role? How do you bring in the innovation, approaches? Because I think innovation is very, very key, right? Because we, if you look at Korea and other countries, the reason why they've been able to really address the pandemic quite well is because they've invested many, many years after SARS, after MERS-CoV, in developing rapid tests, all sorts of science innovations, right? That had then kicked in when you have a pandemic. How do you have a social cultural innovation, a mindset innovation that actually everyone has a role to play in the pandemic? Because at the moment, I think it's not there as much as we would like to see it. I took a drive out to Pahang on the weekend. I saw no one wearing a mask, not one single person the entire weekend. So that frightened the daylight out of me, because they were in restaurants, they were in public places, but no one even bothered or cared about this. So this is symptomatic of what's actually going around in the country now.
So basically, in short, health is actually the wealth of the country. So we need to, invest in healthcare. And looking into the investment, our GDP investment in healthcare is only 4%, or probably less than that. So in public sector, maybe about 2%, 2.1%. So I think now is we need to realize that this health investment is important for us to move forward. Public health is important, but unfortunately, public health is not visible to the public at the point of time. But now I think with this pandemic, then we see how important is public health in terms of for the country. And being a clinician, you can treat one patient at a time. In the public health, with the administrator, you can just save a nation and avert a disaster. So this is why I think we need to invest in the system in terms of logistics, in terms of coordination, software, innovation, etc. And this must be ongoing, not only during the crisis. We should be preparing for a proactive action, not a reactive action to a pandemic. It must be a proactive. That means all systems already in place, from the lab, for example, from the hospital, for example. The moment we say emergency, we can switch in our system to adapt to the new environment. That is a crisis environment. So I think that system must be in place, innovation, etc. rather than reactive. Then only we plan what to do. We already plan what to do, and then when the crisis comes, then we are prepared. So this is the anticipation of what needs to be done in time to come. So I hope that this lesson learned from this pandemic will, create awareness, education to the public, as well as the leadership locally in terms of, how best we can invest further in healthcare in time.
Can I also add, since I'm talking to like-minded, alumni, I think we have to place greater emphasis on public health in the medical curriculum. I remember as an undergraduate not enjoying my public health classes. I'll be sorry for whoever was teaching me then. And they made it so boring, and so and the attitude that public health is not so important, right? Only when I started working, particularly in crisis, that I realized, my God, why didn't I pay more attention to public health when I was in medical school? So I think maybe even, place more emphasis on public health, make it real, right? Make it real in terms of learning from case studies and really rather than the boring, anyone about statistics. But the other thing I want to say is that perhaps even in the master's curriculum, there has to be a module on public health as a revision as part of the requirements for graduating.
So now, if you look into public health now, in terms of modeling statistics, it helps us to predict where we are and where we will be before, and where are we going to face issues and challenges in time to come. So modeling in terms of statistics, then you're looking at apps now. We are using technology in apps. We're looking a lot of system change that is also involved public health. It's actually a very wide spectrum of interest in the public health. I think public health should be made sexy, rather than everybody wants to be a cardiologist or to be a surgeon, etc. So we forget about public health. And that's why now I think the UKM, maybe have to focus in the public health, be strong in public health, not only locally, but regionally and globally. And now we can see how important is public health. I'm a surgeon, but I think it's very important. But I use the concept of in surgery to strike that balance, not hyper and not hypo, but how can you maintain a situation, the life and livelihood. Every time you come to make a decision, it is actually a balanced decision. And then you need to achieve that balance and for acceptance. And you have to engage with the public why you make that decision, and once you follow evidence and science, then they can actually, accept. And acceptance is very important for the public. And once they accept your logic, your, argument, and then perhaps then they build trust. And this, for the last couple of months, we have seen the public trust is high in the Ministry of Health. Because why? We share information. We do not hide. If you do not have the information, we will say we do not have the information, but we are accountable, we are transparent in the way we share the information. But it can be done much better with the dashboard, for example. The public, I don't need to make the announcement. The public can access to the information online, etc. So these are some of the things that we can improve further in time to come.
Thank you for both your views. I couldn't agree more that this pandemic really highlighted how important public health is for any nation. And it has certainly made public health look more sexy, I agree. And there's a need as well for global public health awareness, because an epidemic anywhere, it could be a pandemic everywhere. And I think it has generated a lot of interest amongst our students as well. Moving on to some of the questions that are coming in. This is for both of you. With this COVID-19 new normal, what other changes can we expect in our lives, our work, our economies, and our public policies? And what is our compass or our guide to get our country back on track?
First of all, I'm going to try my very best to change everyone's mindset not to use the word new normal. This is not the new normal. We don't know what the new normal is. We're in a transition phase now to the next normal and then the next normal. So I don't think there is going to be a new normal. So this is Jemilah Mahmood's perspective of the new normal, which doesn't exist. The second thing is, I think what we will have to expect and prepare for is that everything is going to change. Our social interactions, the way we work, the rapid rise of digital tools, getting acquainted with technology in a way that perhaps we've never used before. And also that, some businesses probably have to rethink their strategies and in fact change what they might want to do, because this is what's going to happen for the next couple of years. Now, I say that with one caveat. Perhaps, and there are very good signs now that a vaccine may be in the horizon. Oxford trials have gone well, Sinovac, Russia has done it. We think about 6 of them are quite ready soon. But whether this can be taken to scale and whether there's equity in vaccine distribution and that it becomes a public vaccine is another story. But until that point in time, and even when there is a vaccine, life has changed so drastically that I think we will have to adapt to what that is. One thing that, and I'm going to push very hard for here, is do we really need to go to work in the office, right? I mean, as a woman, I think that many of the struggles of very smart working women is they're trying to balance family and so forth. And I think now we've shown that actually you can work from home. You can also tend to your family. So there are many incentives and also men to take care of the family as well. And I think that what we also need to focus on as well is how to make sure there's also equity in access to digital tools and Wi-Fi and technology and so forth, because we know that in many parts of Malaysia, we don't have the 4G or the internet access. So how on earth are we going to tell children to learn online when number one, there's no Wi-Fi, and number two, there's only one device that they have to share with everybody else in the family. So these are the really complex, situation, issues that we have to deal with as we move towards a much more digital nation and a way that we work. The most difficult, I think, will be relationships. I'm going to say, put the elephant in the room, right? We are in a multiracial environment, and we need interactions with each other because, being in isolation is not helpful to building, relationships among ourselves. So this, I think, we have to anticipate what might, happen as a result of this isolation as well. So I want to underline one thing. Nothing is certain. I think that we are all learning every day. COVID-19 has been the greatest teacher in humility, because just when we think we know how to fix it, we don't. And just as we think we found a solution, we find that there are challenges. So my advice is, businesses need to rethink businesses for the 21st century. Education sector needs to rethink what education is like. All sectors have to really relook and anticipate, the uncertainties, and how do you navigate the uncertainty it's going to be with us for some time. So, that will require a lot of thinking, a lot of sacrifice, and a lot of change in the way we do things.
Thank you for that. We have a couple of questions here coming in. Have there been any discussions with the MKN Majlis Keselamatan Negara on the threat of anti-vaccine groups spreading false news, not only about COVID-19, but influencing parents not to vaccinate their children? And there's also a related question about how the public can play their role against false news, berita palsu.
Yeah, the first is if you look into the engagement, we have hotlines and then we have engagement. We use strategic communication. Social media is very important. We are not only facing the virus, but we're also facing the viral of the social media, the fake news. So we have been using our social media to engage with the public. And you get a reliable news, you know where to get a reliable news. So we continue to activate not only Ministry of Health, also MCMC, to monitor the fake news, for example, and we take action. Those who posted a fake news, we can charge them to court as well. So I think we managed to nick the viral of the fake news, but more importantly, that we have this strategic communication platform. So in Ministry of Health, many of us are engaged in social media. So like me, I'm using Twitter, Facebook, Facebook to engage daily update of information, and I do it myself and assisted by my team giving me the information, but I upload it myself, because anything that before I upload, I make sure that I read it first. Although it can be prepared by others, but I have to read, and I think it's for public consumption, then I will upload it myself. So and then that's the public engagement, and I also listen. The most important being a DG is to listen to the issues and challenges at ground level. So that's where the bottom up feedback. But I do not answer, but I listen to all the comments. I listen to what are the issues being discussed, and then tomorrow I'll discuss it in our press conference and etc. I'll address that straight away, or I'll get evidence and facts to address it. For example, now the issue of why don't we make it compulsory to wear a mask? I think we are strongly, encourage people to put on a mask. But if it comes under a compulsory, mandatory to put on a mask under Act 342, which means that if you do not put on a mask, then you can be given a penalty of 1,000 ringgit or charged in court and jail sentence of 6 months. So that's the implication there. But that's where we do the discussion, open discussion, and we are also discussing these issues. So that's why I think the engagement is important. And now social media is one platform. So much so I become a professional reporter now, giving the latest information. And the mainstream media is taking information from our Facebook because this is the latest information. I don't need to address the reporter every now and then, but it's a continuous engagement with the public. Explanation, issues and challenges, manage the expectation, build trust. And once we have built trust, and then whatever we say. So now basically from this experience, what the lesson learned is that number one, we need to take precautionary measures, public health measures for us to break the transmission. Number two, maintain good personal hygiene. These are very simple. And not only for COVID infection, we also realize because the action of social distancing, wearing a mask, and frequent hand washing, these are three simple measures that we do. And we managed to bring down the measles infection 60%, the chicken pox more than 55%, and hand, foot and mouth disease more than 50%. So see, all the infectious diseases can be controlled if we comply to our SOP, for example. So we hope that the public aware about this and then change their behavior. The most difficult change is to change the mindset and behavior. And this is, should be the norm. It's not the new norm. It should be the norm. And we should teach our children from young in terms of hygiene, in terms of taking precaution measures, as well as to teach the public. And this is a good thing. And why are we not doing it? So that's the question, which means we are not looking into reactive because of pandemic, we have to change. No, we need to teach public health measures and as well as hygiene from day one. And this is where then healthy living we're talking about. Not only when you have a disease that we come in. Public health is about prevention. So this is all the preventive measures that we can take from childhood, for example. So I think this is some of the lessons learned that we hope that we have to look into a bigger picture, not only during the pandemic crisis. This is where a healthy nation is actually a very important economic sector that you see. That if, for example, now if we go back to lockdown again, that will be a disaster for the whole country. So now I think the public has to come together to understand the situation well, and then to change their behavior and their mentality. And this is why we need to have continuous update and a reminder to the public. And hopefully, we can make a big difference in time to come.
I think that I think we've adopted a little bit of a good cop, bad cop, and I'm the bad cop. So, Hisham is the loved hero who will tell the public everything, and then I will be the one tweeting, some machi eating in a restaurant or something. But we felt that it's really important for the public to know that there are people who are, really flaunting the regulations and the laws. I mean, the standard operating procedures, because they are harming other people in the process, right? But on the question of anti-vaxxers, I think that's a really important question, because at the moment there's no law, right, on anti-vaccine this anti-vaccine group, and I think this is something seriously we have to look in, because potentially this is as someone, if someone is an anti-vaxxer, they say, well, that's my right, so they play the human rights card, right? But there's also rights of the public in terms of disease protection and so forth, and we've seen the impact of a disease like COVID-19. But worse than that, we're also seeing emergence of measles outbreaks and diseases that were considered not common at all. We've seen chicken pox. We've even seen the emergence of smallpox in some countries. So this is something that I hope the Ministry of Health will look into very seriously as part of national security. And I think your question on how does that then tie with NKN, National Security Council, is an important one. I think we, as we are coming closer to the possibility of a vaccine, we have to really think about this. And again, that can be also, a very good public health move, obviously, because there are other diseases that people are not being immunized against. I was in Kedah recently, and DG asked me to pop into an area in Kedah where there's been an outbreak of diphtheria. I've never heard of people getting diphtheria for the longest time. But this is again, groups that are isolated, that don't want to get vaccinated and so forth.
So there are still many challenges ahead of us, but building on the earlier comments about the civil society, the public awareness and the importance of educating even from a young age, and all sectors having to adopt or bring health components into it. So there is a question here: what important policy would you recommend to all sectors in Malaysia, so that all sectors will bring along the health or the cleanliness aspects as part of their sectors to prevent pandemics in future? Meaning, in terms of policies, how can we build in these health considerations into all sectors? If you have some thoughts on that.
Well, policies-wise, I think it's very clear. I mean, Ministry of Health has been preaching policies in terms of precautionary measures, maintain personal hygiene, etc. But now the issue is to empower the public, empower the community, empower the family and individual to take care of themselves, their hygiene, and their look at dengue, for example. Everybody knows about dengue. And but when we go down to the ground to do the gotong royong, we are the one that doing the gotong royong, and the public is actually watching us. So, but they are not embracing it because they thought that it's part of their life. But they need to change, because public health is about the public. It's not about the Ministry of Health only, but it's on the public to enforce it. So what we are trying to do now is to empower the public. Meaning, if somebody is smoking in front of you, then the whole restaurant have the right to actually, to take action on that person. Likewise, if you're not wearing a mask in a public places or in the LRT, for example, then the public can actually take action. And that's where we want the empowerment of the public, and to do things, but to understand the situation and to do it rightly, not only from the policy aspect. Sometimes there's many policies that we have, but it's not implemented at the ground level. Yeah. So now it's bottom up now, to empower the public to do what's right. And we need to give the information, yes. We need to give the guidance, yes. But the empowerment must be there. So they take care of themselves. And this is the success that we can actually achieve. If they take care of themselves, then I think there's a way forward. As far as the vaccine is concerned, today we do not have the vaccine yet. But what I'm trying to say is that while we research the vaccine, but if we were to take the public health measures like we did for SARS, for MERS-CoV, we do not have vaccine, but we managed to eradicate, eradicate SARS and MERS-CoV without a vaccine, but only using public health measures. So if the public comes together to understand this fact, then we can actually emphasize on our prevention and the preventive measures taken by the public. So in terms of compliance is important, changing of the mindset is important. And I think most important is social discipline. If the public have this sense of belonging, social discipline, social responsibility, and compliance to the public health measures, rest assured we can contain the infection.
If I may build on that, I think that, it's everything DG has said is absolutely spot on, but we have two things I think we need to also focus on. If we empower the public to take action, then where is the enforcement? So that link to enforcement is going to be very important, right? I mean, I have been in lifts where there's, I go in as the only person and then 10 people want to come in and I tell them no and they shut me out, right? I have no recourse but to leave the lift. So things like that, people not wearing their mask on their chin all the time, this really very dangerous habits. The second thing, I think it all also boils down to education. Now, I'm not talking only about formal education, it's home. How do you inculcate from home, parents, to be able to, make it a habit for children to take care of their cleanliness, wash their hands, keep themselves clean, and so on and so forth. I said, and then of course in the education system as well, how do you bring the morals, hygiene, ethics, back into our education system from a very young age? But when we say this, we are privileged, right? We are sitting here in Putrajaya, we can turn on a tap. There are many people in our country and around the world that don't have that privilege and luxury. So how do we make sure as well that we look at, the most vulnerable among us who may not be able to have the access to such facilities that we're talking about. So I think this again comes down to, the whole of the society, policies that are affirmative towards most vulnerable people, and equity. I'm a big fan of something called donut economics. So if you haven't read it, please read it. And it talks about, how economists have really, it akins economists to the cuckoo bird, right? That goes into a nest and kicks all the other birds out and then goes fatter and all that. So, the whole link on why is it that we look only at the growing and fattening GDP as a measure of success. So I think we can look at countries like New Zealand now that are adopting very different models in looking at economic development. So, I think it's time. If anything, I hope COVID has taught us to be more humble, more grateful, to be more caring towards each other, rather than, being much more selfish and only wanting things for ourselves, because no one is safe until everyone is safe.
So thank you. I think we're hearing that we can all learn to be more compassionate and caring for each other after this, lessons learned from this pandemic. There's a question here which is a bit more of a personal nature. What are the motivations that drive both of you to stand strong in managing these challenges?
If you look into why we took up medicine in the first place, it's because we want to serve. That's the key, the most important, and you must be sincere. It's not because of dollar and cents that I took up medicine, but because we want to serve. And because of that, so you must be sincere to yourself. That is what we want, comes from the heart. So if we can serve and, to do things well, and whatever responsibility given to us, I think from medical school until today, we take it seriously and then we deliver. So, and sometimes, it may be a new experience, it may be a new difficult challenge, or even a difficult case, for example. You have no experience whatsoever, but the first is your intention. If your intention is right, that is to serve the people, not here for popularity. We are not here for popularity. We're not here to be a celebrity as well. So, our intention is to serve. And that is the most important core intention that we have. Then you build up on that is that how do you deliver it? Where do you deliver it? And then this is the issues that we discuss clearly, and you get buy-in. And it's not from top down authoritative way of doing things. It is actually a collective, because we listen to everyone. Everyone in our organization is important, giving their views, doing their job, and then we collectively bring it up as our policy to move forward. So the thing is that when you do it because of sincerity, with passion and dedication, you are willing to do it not because of money, I think, and fame or whatever. It is basically the sincerity that is the one that guide the public, guide the people together for a common goal, that is actually to serve the people and to avert a national crisis in this country. I think during this time, you can see, if that's your intention, you will walk, extra miles for it. And then a lot of our frontliners, are doing what more than the call of duty, for example. Why? Because they know that they have a role to play. And if everyone play their role, I'm sure that we can coordinate efforts. And as I said, it's an endless possibility. And that's why I think after having prepared, planned, and then we have to, hope for the best and then pray that we get the blessing. And now, I think after 6 months, we are seeing a flattening of the curve, as well as less cases, and then we should count our blessing if compared to other countries. But success breeds complacency, and complacency breeds failure. So there's a cycle back again. So now our fear is that whether we are able to sustain for a period of time. We are not talking about 1 month, we're talking about 1 year, 2 years, 3 years, until we have the vaccine. What if we do not have the vaccine and the virus is still around? So we need to live with the virus. And how do we, make, adjust ourselves living with the virus? This is the biggest challenge. The only way to do is changing the mindset, and then taking all the precautionary measures, public health measures, as well as maintain a good personal hygiene.
Yeah, I completely agree with DG. For me, I've lived abroad now more than 12 years, so I'm now finally back for good. And it has been, for me personally, a journey to learn, because I felt that, Malaysia is so blessed, doesn't have many disasters and all that I needed to go out and learn, and so that one day I'll be useful, and that day has come, right? So apart from, that it's a sense of duty, it's also such a privilege to be able to do this. I don't think that, yes, it's, our amanah, and we feel that it's our duty and that we want to serve the people. But my gosh, what a privilege to be able to do that and not to be on the receiving end. I tell everybody I know when they ask me, I say, I always imagine what will people say, when I'm dead, right? What will I be remembered for? Will it be remembered for my wealth, which I don't really have, but will it be remembered for the fact that I tried to make Malaysia or the world a better place, right? So I think our life is so finite. And we've just been so privileged in so many ways. We've gone through so many hurdles in our life, but my gosh, we've reached a point where we can actually work together now, for the good of the country, for the good of the world.
Thank you. That's really certainly very thoughtful answers. We have a question that's come in asking, how can and should NGOs and non-profit organizations become more engaged and coordinate or liaise with KKM efforts?
Okay, I think I mentioned earlier on about a platform that I have advised, but a group of people have established, and it's fantastic. It's just new, but it's already capturing. I can give you some raw data that even among 17 NGOs and private sector, we've captured data that 160 million ringgit worth of programs have been delivered. This is fantastic. For the first time now, we can actually say the whole country came together to do this. And I'm sure there's many more, organizations that have worked so hard and individuals that we haven't even captured. I think that, coordination is never easy, I will tell you this. And sometimes some organizations are better left uncoordinated, particularly those who work within communities. Let them get on with it. We don't want to add layers of bureaucracy, right? But one of the aims of this platform is called MATCH, Malaysian Action Coordination Hub. If you go to Kita Match as one word, you will find a website. Don't put kita dot space match because that's a dating site. But you know, you will see, you know, the input that people have given. Now, one of the biggest aims of this is actually to support capacity development of civil society. Being a civil society actor means that you're independent, you're able to deliver your best. You know, that's how civil society works. But there's also things we want to capacitate in terms of accountability, making sure that, you know, you do good financial reporting, you're honest, you're also being able to give assistance that is not partisan, you know, that everything, you know, it has to be based on principles. So those interested, reach out to me or go to Kita Match and then I can direct you to whoever's in charge. But the Malaysian Red Crescent is co-chairing this at the moment, but we are building it to be an independent entity.
Thank you.
And it will be the first time in the world, by the way, that you bring private sector, society, and government. Yeah.
Datuk, do you have anything to say about the partnerships with the NGOs?
Well, I think it's very important that we continue our partnership with the NGOs. For example, the major floods in 2014, and we realized that at that point of time, see, NGOs came in, and then, but we do not have a system then, you know, in terms of coordinating the NGOs. Then in one area, then you realize that the Ministry of Health go down the same area, and a few NGOs in the same area. So we are doing duplication at the ground level. So now if there's a coordination, you know, in dashboard to look into which NGO do what, and this is where I think then Ministry of Health can actually capitalize on the role of the NGOs and then to coordinate. And today, for example, in the looking into our crisis in pandemic crisis, when we are short of PPE, the NGO came in you know, to assist us, you know, to make the PPE for us. Every sector, even the prisoners, the fashion designer, and you know, it offers. Everyone comes in to actually help the Ministry of Health because there was a global shortage of a PPE then. So we can make our own PPE. Why cannot? Why can't we? And looking in the gloves, we are the major manufacturing for the glove industry. About 60% comes from Malaysia. So we have to look into the mask, we have to look into PPE, we can do it. And this is where I think, you know, the public wants to contribute as well. The NGOs want to contribute, but we need to provide a platform for them to do it. This is where we encourage the consolidation or integration of the services that we have between the public and the private. So that's why we use this leadership is basically on the whole government and the whole society approach, bringing the NGOs together. And the NGOs are very important. Our success, for example, in HIV is because of the NGOs. It's not because of the Ministry of Health, but Ministry of Health guiding them, funding them, and then they do their role. So they can reach out to the public much better than us. So they are top down, they are bottom up, you know, and then we meet in halfway, and that's where we get the best of outcomes if we can actually utilize the NGO. And I think this is something that we need to look back. How can we enhance the role of the NGO during crisis? How can we enhance the NGO in healthcare and etc.? So I'm sure that this is a very important topic, and then we can actually coordinate the implementation in time to come.
Thank you. So we're coming to the last 5 minutes of our Q&A session, and probably we only have time to answer just one more. Sorry to the audience, there's still quite a number here. Thank you for such an excellent, inspiring talk. My question is about the budget allocation to MOH. Is there going to be more allocation in the coming years? For example, last year, only 30 billion, but about 300 billion has already been spent to control COVID.
Well, in Ministry of Health, we prepare for the worst and then we hope for the best. So we hope that by this, pandemic, I think the allocation can be increased, whereby now I think GDP for healthcare in the public sector is among the lowest in the world. So despite whatever we have, I'm the person that work whatever we have, rather than asking for things that we do not have. But we look into our system, then we can certainly optimize the resources that we have, optimize the resources, high impact, reasonable cost and good outcomes. That is our strategy all along. So if we can be given more income from our funds, for example, then certainly we will invest and make sure that our impact will be much better, as well as the outcome will be much better than what we have today.
Okay. There's another question about, is Malaysia also involved in assisting other countries in the region, especially such as Indonesia, for example, in curbing the spread of COVID-19? Are we playing a role regionally and internationally?
We are playing a role. Basically, we are using the platform of the World Health Organization, whereby we share our information, share our experience in the World Health Organization webinars, as well as regional committee meetings. So hopefully, by doing so, the World Health Organization will be the one that advise the respective countries the do's and not, and the best practices. So I think we share the best practices to the World Health Organization, and they are the one that taking the role to advise the respective country. So, but if there's actually a direct request, a G to G to Ministry of Health or to the government, then the Ministry of Health will do the necessary. At the time, at the moment, we do not have an official G to G between the two countries in terms of pandemic COVID-19, but the assistance comes from the World Health Organization.
If I may add to that, I think that at the ASEAN summit, and even before the ASEAN summit, the heads of the health ministries had convened and discussed and shared lessons learned. At a personal level, I've been advising some countries. So I think that this is a very important point, because ASEAN for me is a very important regional body for us, because we are in part of ASEAN. We are one of the founders, and there are 600 million people living in this region. So one of the things I have been pushing very hard and advocating for is that how does ASEAN as a bloc actually negotiate vaccine access, because you have more power as ASEAN 10 countries than Malaysia alone trying to say, give me vaccines. The other thing, of course, is then how, one of the things I wrote about recently as well with a group of friends is, how do we maybe hope to change IMR into an ASEAN CDC, right? To really take it one step higher, one step further. And I think these are very important things that we need to think about. Our role as leaders in the region, our place in the global agenda as well. I mean, you saw that, Gigi is probably too shy to talk about it, but he's considered one of the top 3, physicians in the world leading on the pandemic. And this is because of the transparency and the trust approach. But this is critical. If you don't have that, you lose the engagement with the public. And it's not rocket science. It's basically good listening powers, good listening ability to communicate in a way that's clear. So, and we are so proud that, he has been able to do that. But we, as Malaysia, in our success, I feel, have a duty to also support those who are struggling a little bit, right? Not just ASEAN, OIC member countries, NAM, and so forth. And there's a lot we can do.
Thank you, Tan Sri and Datuk Ji. So, nampaknya masa telah berlalu dengan sangat cepat dan masa mencemburui kita. And it's always like that when there's a very good discussion going on and the time flies. There's been great deliberation and discussion. So if I may summarize, it's really trust, transparency, collaboration, and cooperation that will see the country through together as a nation, and to preserve the success that we have, to learn the lessons that they are to learn from this pandemic experience. So I'd like to draw this excellent forum to a close. And sebelum saya mengakhiri bicara ni, saya ingin mengucapkan terima kasih kepada kedua-dua alumni tersuruh kita dan panelis pada pagi ini. Terima kasih yang berbahagia Datuk dan yang berbahagia Tan Sri. Dan sekarang saya menjemput Yang Mulia Profesor Raja Effendi, Dekan Fakulti Perubatan untuk menutup majlis kita pada hari ini.
Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Terima kasih saya ucapkan kepada Prof. Roslina dan yang dihormati Prof. Datuk VC kita, Chancellor UKM dan ahli panel kita, tokoh negara kita pada masa ini yang telah menjalankan tugas dengan cemerlang untuk negara kita dari segi leadership dan approaching how to handle the pandemic. So kita dengar tadi daripada Datuk DG kita, public health medicine should be a sexy type of medical specialty in the future. Dan kita juga mendengar komen daripada Tan Sri Dr. Jemilah, the next normal. Yeah? There's no such thing new normal. Maybe next normal 1, next normal 2 dan sebagainya. Yeah? So there's a message, important message daripada dua tokoh alumni kita dan kita berbangga. We are very pleased, we are very honoured, we are very proud. And every single house in the nation now mentioning about Datuk DG and Tan Sri Jemilah. So very proud from the Faculty of Medicine that you have the DNA of UKM and you actually build the nation, you actually train the nation how to avoid hopefully the second wave or second pandemic. Bagi pihak pengurusan Fakulti Perubatan, kami ingin memberi token of appreciation here ya kepada dua-dua panel kita dan Datuk VC juga yang telah hadir dalam Bicara Emas Alumni, token buku yang telah dikarang oleh Profesor Emas dan Profesor Noliza, kenangan sepanjang zaman, Memories in Time. Kita akan hantar kepada mereka ini buku 165 pages. I hope guys you have time to go through every single pages. It's a very hard work and dimulakan dengan kata-kata aluan daripada Datuk Naib Chancellor kita yang mana menceritakan cabaran, rintangan yang perit yang dihadapi oleh fakulti kita 48 years ago until we see the bond of two leaders sitting in front of us managing the healthcare of our countries. So very proud. So saya dengan ini menzahirkan acara kali ini dengan membagi token of appreciation kepada dua tokoh negara kita, alumni Fakulti Perubatan UKM, sama-sama menghadirkan diri dalam Bicara Emas Alumni Fakulti Perubatan UKM pada hari ini. Sekian. Assalamualaikum warahmatullahi taala wabarakatuh dan salam sejahtera. Silakan seterusnya Encik Bukhari.
Okey, dipancarkan ni adalah link untuk order buku tersebut bagi yang berminat. Terima kasih.
Itu saja. Salam sejahtera, salam hormat dari Fakulti Perubatan. Curahsia kepada Datuk Naib Chancellor dan dua tokoh kita, dan saya difahamkan lebih 1000 penonton pada pagi ini dan semoga semua di sana mendapat manfaat daripada bicara perdana pada kali ini. Sekian sahaja. Assalamualaikum warahmatullahi taala wabarakatuh. Salam sejahtera.